Okay, guys. So I'm trying to work this PowerPoint, okay? So just bear with me. Anyway, you probably realized that we kind of got ahead of ourselves and we started chapter 13. Um, However, you all haven't tested yet on your chapter 11, your AV blocks. So we're going to back up and we're going to do a couple of days of review and then we'll test on chapter 11 on Friday and then continue on with chapter 13. Okay? So here we are. Here we're going to start out with a little poem about the AV block. And it says, if the R is far from P, then you have a first degree. Longer, longer, longer drop, then you have a Winky block. Okay, see our PR interval getting longer. If some P's don't get through, then you have a Mobitz 2. If the P's and Q's don't agree, then you have a third degree. That's just a cute little poem. You guys can memorize it if you like. It does help you to remember and be able to identify the AV blocks. So it's a useful tool. You can use it if it works for you. If not, then you can come up with your own or just whatever helps you to learn these, okay? So the degrees of AV blocks, you have 3 degrees. You have your first degree, in which there's a delay in the transmission of the impulse to the ventricles, and you have a long, prolonged PR interval. Your second degree, some of the sinuses get through, some of them don't, and eventually you have a dropped heartbeat. And then with your third degree, you have a complete block of the impulses getting through to the ventricles, and your P waves and your QRS complexes do not agree with each other. Okay, so you may have several P's here with no QRS and vice versa. Okay, and here we're looking at all of them together to compare. So if you look at your first degree, look at your PR interval. There's your P wave. Here's your interval, and then here's your QRS. Okay, so right in here, if you look at your PR intervals, they're prolonged. Okay, here again with your second degree, as you progress through that PR interval, it gets longer and longer, and then eventually it drops your QRS complex. Okay, you see here, here's your PR interval, here's your QRS complex for that one, here's your PR interval, here's your QRS complex for that one, here's your PR interval, and your QRS for that one, and then here's your P, but there's no QRS. Okay, so that's what we call a Mobitz 1 or a Winky box. And then you have your second degree, in which you can have two P waves to one QRS. Okay, and then your third degree, you have your prolonged intervals, and your P's and your QRS complexes are disassociated from each other. Okay, I will post these little diagrams on a Word document for you all to have as a reference. Okay, so here we're just looking at a diagram of your SA node, your AV node, and here we have a block at the signal uh, before it gets, just as it gets to that AV node, it can't get past. Okay, on this one we have, it gets past the AV node, but there's a block down in the bundle branches. Okay, the word on AV block. So your underlying rhythm is going to always be your sinus rhythm. Your P waves are therefore sinus P waves. The problem is you have either a partial or complete blockage of that impulse from between the SA node and the ventricle. Okay, your heart rates can be normal or very slow. and the patient may or may not have any symptoms. The criteria for your AV blocks is a prolonged prolonged PR interval greater than 0.20 seconds, or some P's that are not followed by a QRS, and regular P to P intervals. So again, we said our first degree, we had prolonged PR interval. And usually this is the result of some type of ischemic episode, okay? Where they have some type of blockage. They're not getting enough oxygen. Continue with the first degree. The heart rate, first degree can occur at any rate. The regularity depends on the underlying rhythm, and your P waves will be upright and matching. You'll have a QRS for each P wave. Okay. First degree, some of the causes, ischemia, digitalis toxicity, or medication side effects. First degree block is seen only with rhythms that originate in the sinus node, and usually there's no adverse effects, and the treatment simply consists of removing the cause. Moving right along to your Mobitz 1 or second degree AV block, which is also known as the Winky block. It's usually a transient block that can last for a few days. The AV node becomes progressively weaker, and finally it becomes unable to send out the impulse. And eventually your P wave will not be followed by QRS. The atrial rate can still be at 60 to 100. Your P waves will be upright and matching with until you get that one block with no following QRS. Again, some of the causes of your Mobitz 1. This patient could have had a heart attack or digitalis toxicity or medications. It usually does not require any treatment. However, if that patient is symptomatic, they may give him atropine or put on a transcutaneous pacer. This is another rhythm example of your Winky block. So your Mobitz 2 or second degree, there's a block at the bundle branches. With the AV node block, the resultant QRS complexes will be narrow. However, if that block is occurring down in those bundle branches, then your QRS is going to be wide. So that's another determining factor when you're looking at your EKG strip and you're looking at those QRS complexes. If it's wide, then that tells you that there's a blockage somewhere down in the bundle branches. And if it's real narrow, then there's a block up high above that AV node. Usually Mobitz 2 patients already have some type of bundle branch block. So usually with these patients, one side is already blocked, okay? Your rhythm will look like a sinus rhythm with all the P's in place, but some of your QRSTs will be missing, okay? With the Mobitz 2, your heart rate can still be at 60 to 100. Your P's upright, some blocked or some hidden. But you'll have your PR interval be constant on the conducted beats. Some of the causes of your Mobitz 2, again, can be a heart attack, some type of conduction system lesion, hypoxia, or medications. Adverse effects could be that patient presents with decreased cardiac output, they're short of breath, maybe weak, and the thing with your Mobitz 2 is it can progress on to a complete block. Okay. The treatment is for Mobitz 2 is going to be immediate transcutaneous pacing if they're symptomatic, and then they'll proceed, if that does not remedy the situation, to medications in which they'll be pushing atropine, epinephrine. The patient will be on oxygen and dopamine. With a narrow QRS, atropine should work. With a wide QRS, epinephrine is a better drug choice. Okay. Here we have an example of our Mobitz 2. Now, a 2-to-1 AV block. This is a type of second-degree block in which there are 2 P waves to each QRS complex. The first P wave in each pair of P waves is blocked. It can be caused by either a Winkie block or a Mobitz 2. And the sequence of this on the strip will look like this. You'll have a P, then a QRS, and a T. Okay. So with your 2-to-1 AV block, you're going to have be looking for 2 P waves. Heart rate again can still be maintained at 60 to 100. P waves will be upright and matching 2 P waves to 1 QRS. Some of the causes of your 2-to-1 AV block is, again, patient may have had a heart attack, medications, hypoxia, or some type of conduction system lesion. Adverse effects, they will have decreased cardiac output, and the treatment again will be your pacemaker, okay, and your first line of defense drugs, your atropine, epinephrine, dopamine, and oxygen. Here's an example of your 2-to-1 AV block. Here we see our 2 P waves to our 1 QRS. Again, 2 P waves, 1 QRS. 2 P waves, 1 QRS. Okay. With your third degree or complete block, the sinus node sends out its impulses as usual. However, none of those electrical impulses are making it to the ventricles, okay? A lower pacemaker escapes and assumes pacemaking control, providing the QRS. However, it won't be able to maintain that heart rate between 60 and 100, okay? So that these patients are going to have a very slow heart rate. Their ventricular rate is usually going to be between 20 and 60. Their P waves will be upright, matching, but will not have any association to the QRS complex. And also with your complete block, you may have those hidden P waves. Adverse effects will be decreased cardiac output, and of course, treatment for these patients, they're definitely going to get a pacemaker, your heart rate increasing drugs such as your atropine, epinephrine, dopamine infusion, and oxygen. Also, one other thing I want to point out with your third degree block is if you suspect that third degree block, look at the QRS, and it will give you an indication of where that block is, whether it's above the AV node or whether it's down in the bundle branch. So if it's at the AV junction, your QRS is going to be narrow, and if it's down in the bundle branch, that QRS will be wide. Here we see an example of a third degree block. Quick tip for differentiating AV blocks. First degree, there's no dropped QRS. The Winkie block, you gradually have a prolonged PR interval until you lose one of your QRS complexes. And with the Mobitz 2, the PR is constant and some of the QRSs are dropped. 2-to-1 AV block, you have 2 Ps to every QRS. And with your third degree, your PR interval varies, your R to R is constant, but there are some QRSs that are dropped And remember, you have no association to your P waves and your QRS. Okay, and here's a good illustration of that third degree block. Here we have our P waves and QRS complex are completely independent of each other. And of course, we know here what if someone gets into a third degree block, they are going to be, if not treated in a pacemaker, put on immediately. These people will progress to cardiac arrest and possible death. Okay. So what's happening with that third degree block is you have no communication going on between the top part of the heart and the bottom of the heart, between your atria and your ventricles. There's no communication to cause that heart to beat. Okay. So we're going to stop there, and tomorrow we will review again. What I'd like you to do for your assignment is come up with your own little poem on remembering the AV blocks. It could be whatever you come up with that will help you to remember, okay? Submit a picture of your assignment when done, and also draw out an example of the strips, okay? An example of your first degree, second degree, and third degree. Of course, you know I like to use the different colors to label, and also tell me, identify which block it is, okay? And what the distinguishing characteristics of that particular block is. All right, I will see you guys tomorrow. Bye-bye.